Peminat hati penuaan wellness estetik regeneratif Indonesia berdamai. Kami selalu menjunjung tinggi kode etik sumpah profesi bertanggung jawab pada negara untuk sehatkan bangsa berpedoman kepada Pancasila Undang-Undang Dasar 45 dan selalu terus membangunkan pelatihan ilmu dan keterampilan mempercantik bukan mempesona tingkatkan kualitas hidup sehat dan bahagia bersama Pedaweri remajakan jiwa raga hilangkan duka lara sehat dan bahagia bersama
Welcome to Iswam Virtual 2021.
Hello, good afternoon, everybody. Welcome back again to 11th Virtual Iswam 2021. Today is the Thursday, the 21st of January 2021. We will have the session of the 16th session. Okay, so for this afternoon, I'm Dr. Santi, will be the chairman for this afternoon session. So this afternoon, we will have the major topic is the role of neck and decollete in aging. As we know, people say that the skin on the neck and decollete area can describe your age. And a few years ago, many people only concerned about how to be look younger from the face. But nowadays, people also concerned about the neck and decollete area. So let's hear from our speaker today. We will greet our first speaker. Hello, Dr. Riekie Smith. Hello,
Good day.
Dr. Riekie Smith. Yeah,
Yes.
how are
Okay.
you there?
Very good. And you? Thank
Yeah,
you very much for including me in this session. It's always such an honor to be part of the ISWAM, and I've always come to the Congress in Jakarta.
yes.
But even the virtual one is really very good to be part of. So thank you for this.
Thank you very much, Dr. Riekie Smith. Dr. Smith has been our speakers, yeah, in ISWAM, in last ISWAM. So thank you again. During the pandemic, you still have time to share knowledge and experience with us today. Okay, before Dr. Riekie Smith start the presentation, so this afternoon, Dr. Smith will talk about practical aesthetic treatments for neck and decolletes concerned. I will briefly read the CV of Dr. Riekie Smith. Dr. Riekie Smith from South America. She has a private practice in Pretoria, South Africa. Dr. Smith is the founder and ex officio president of the Aesthetic and Anti-Aging Medicine Society of South Africa and chairperson of the Aesthetic Medicine Congress of South Africa. Dr. Smith is a global KOL for various aesthetic, medical, and pharmaceutical companies in the industry. Okay, for Dr. Smith, please, you may start your presentation.
Thank you very much for the introduction. And I'm not sure, I know in Indonesia it's afternoon. For me, it's now 9 a.m. in the morning in South Africa. Wonderful summer's day here. And for anybody else connected, a good day or good evening to you. And I really hope that you're going to enjoy this session. So I'm really going to share some of my practical experience, but also I've included a lot of scientific evidence of what has been proven to work for neck and décolleté aging. And then I will be very happy at the end. I've left some time to answer your questions so that we can remain connected, even if we don't see each other at the congresses and can talk in the coffee breaks and then the lunch breaks. I think it's important to interact in all of these live webinars. So I will be very happy to answer your questions also. So thank you again to the organizers for making this possible and for connecting all of us to stay up to date. So as I said, I'm going to talk about practical aesthetic treatments that work for both the neck and décolleté concerns. And I'm going to first start to talk about the different types of concerns that people have, women and both men, but especially women on the neck and décolleté aging. And as we know, the neck and décolleté, and as Dr. Santi has also said, is we often see our age from the neck, and we often say a woman's face looks so good and she's had many treatments, but the neck actually gives away the age. So it's the first thing that we really start seeing signing. In certain people, genetically, they see quicker aging in the neck, and also in certain ethnicities, we also see much earlier aging in the neck. So it really varies from person to person. But what do we really see in both the neck and the chest or décolleté area is a really skin laxity. Especially from over the age of 40, especially women will start getting concerned about skin laxity and looseness, and this progresses then with aging. Wrinkles, and wrinkles are typically the horizontal lines that can start from as early as the 20s already. Then dyspigmentation, because it's such an exposed area and often neglected area, that's not so much treated as the face is, we often see pigmentation. And on the chest area, we see even more pigmentation because of the difference in the epidermal and dermal structures of the chest area compared to the face. And we know also the chest area is quite a high risk area for sun-induced skin cancers and precancerous lesions. And telangiectasia is also very much UV induced, but can also be slightly hormonally induced and can also be due to lifestyle factors. Then the other types of concerns that I will also talk about, the treatment options, is excess fat, so the typical double chin. The platysmal bands that looks really more pronounced in very skinny type of patients, and especially those very active older women that you really see the platysmal bands. Then other vascular things such as poikiloderma of Savart, and then your specific UV-induced skin lesions. So the neck and décolleté is very different to the face. And the difference of the skin on the neck and décolleté to the face is, first of all, that we have a thinner skin. The skin is significantly thinner, especially because there's less sebaceous gland and dermal appendages. There's a lot of UV exposure, and only at a later stage do people start becoming aware that they also need to protect the neck and especially the chest area. In certain countries, especially female are expected to cover the neck and chest area, and they are very much protected from this UV exposure. And then again, in other countries, the women really like to keep this area very open. So there's a lot of cultural differences that also gives rise to faster aging, as we can see, especially in the European countries. Often they have severe UV exposure to the neck and chest area over the summer months, especially July, August area, and going to the beach, and they're not used to exposing this area in the winter months. Then the less dermal appendages also give us this continuous aging process, and actually the premature aging of the neck and chest area. Continuous movement of the neck also gives rise to this neck laxity, the wrinkles, platysmal bands, and also now the new thing is the tech neck, because of the position that we sit with our phones, either in this type of position, clasping between the ear and the shoulder area, giving these lines, or just the continuous looking down on the phone, giving rise to these tech neck that we see in the early 20s already in the youngsters, the millennials, starting already with those wrinkles. But altogether, we know it's a very high risk area for UV-induced skin damage. And I think this is quite important to realize. So photo-damaged skin of the chest is characterized by all the significant aspects that I described in the previous slide of laxity, lines, wrinkles, pigmentation, erythema, roughness, atrophy, and then telangiectasia. And there's quite a lot of interesting scientific publications to show this premature aging. As you can see, one of them that I quoted here is from Peterson and Goldman that you can go and read. Before I start with the treatments, I think there's just a caution that we need to remember. The chest skin contains fewer sebaceous glands and other appendages than the facial skin. And this results in slower reepithelialization, and it could lead also to prolonged erythema after any type of ablative or resurfacing treatments. And this was described in this article from 2013 by Simes. But also this is what I've seen in practice. The most significant burns that I've seen is on the chest area, and patients coming after IPL treatments that they've had significant burns they didn't want to heal with really terrible hypopigmentation, hyperpigmentation. We also know that we see really terrible basal cell carcinomas, really bad scarring. It's a very highly prone area for keloid lesions. It's a very difficult area for keloids. There's many articles on the difficulty of treating keloids on the chest area, a lot of Asian publications on this. So we need to remember reepithelialization occurs from the dermal appendages, from the hair follicles, from the pores. So those epidermal cells need to move through, and if there's less hair follicles, less pores, we get slower reepithelialization because it has to occur from the side. This is something that you really need to take in consideration. You cannot do the same depth of laser on the face that you do on the chest. You cannot do the same depth of peeling on the face than on the chest, especially if the skin is very atrophic. If you really see it's very UV damaged skin, it's a thin skin, it's a crepey, leather looking skin, be extra cautious, because often that type of skin you want to treat deeper. But the deeper you treat it, the more you have risk of prolonged erythema, delayed healing, scar formation, hyperpigmentation. So something especially to consider, to rather do more superficial and combined treatments than to go deeper. Okay, so let's start looking at all the different conditions and what we can do. And I think this is the very first step to take in consideration, is that we need to make a diagnosis, and that we need to understand what is the concern of the patient before you actually start treating the patient. Because you need to know, okay, this works or this doesn't work, and patients say, but can I rather have this treatment or that treatment? But you need to make a diagnosis. So skin laxity is really the loss of collagen, elastin, the atrophy that we see in the neck, as we can see in the first image. And that type of skin, we need to think about skin revitalization, skin restructuration, maybe ablative procedures, skin tightening procedures. Then wrinkles of the skin, there's quite a few treatments that we can consider. We can do the skin revitalization. We can do this very fine fillers that I will describe in the lines of the neck. We can do ablative fractional lasers. We can use a lot of the energy-based devices. So there we rather want to focus on increasing collagen, especially in the wrinkled area. Then pigmentation on the neck as well as on the chest is where we need to bring in the type of treatments that works on, first of all, exfoliation, so removing the melanin deposits in the epidermal layer, and then second of all, actually breaking up those melanin either within the epidermis or within the dermis and the melanophages with laser type of treatments. Peelings are also very successful for treating pigmentation on the skin of the neck specifically. Then vascular. Now, vascular concerns are very common in the neck area. Especially on the neck specifically, we see very commonly the poikiloderma, and very highly prevalent, especially in Caucasian patients. Even up to Mediterranean type of skin, we can see poikiloderma with this typical red-brown discoloration, and often just underneath the chin, the white area. Now, vascular treatments do not really respond, vascular indications don't respond very well to chemical peelings or injectables. It might improve a bit, but there we need to bring in our vascular lasers to get improvement of the vascularity. Then as we go to double chin, so now we're more on the fat aspect, and double chin is a very big concern, and especially with all of these Zoom meetings and virtual meetings, then people are often concerned about seeing their double chin in the camera, and I've really had more requests from patients for this. So here we look at treatments that will reduce the fat pocket. And then usually after the fat pocket, we also need to tighten a bit. So I'll discuss those options. And then, as I said, the muscular bands, the platysmal bands, very commonly seen in patients that are especially female, active, mature patients. This picture is a patient of mine that's 57 years old and a marathon runner. So very typical in those type of patients. And it really makes even though she doesn't have so many wrinkles or pigmentation, it makes their neck look really old. And the problem with these platysmal bands is it stretches the skin, that you actually get bands of skin hanging the older that the patient gets. So the sooner that we can treat those platysmal bands, the more preventative we can also be on the skin of the neck. And then obviously we never have to forget that we are doctors and we need to make sure patients are healthy and not just beautiful. So we need to be able to diagnose skin lesions and know when it is an actinic keratosis or a non-melanoma skin cancer, or when has it already progressed to maybe superficial spreading basal cell carcinomas, or even in-depth. So all of your BCCs, SCCs, Bowen's disease, those type of conditions, moles you need to recognize, especially differentiating skin tags, maybe from amelanotic nevuses. So those type of things we need to also keep in consideration before you just take off lesions, is to make a good diagnosis also. Okay, so how can we classify our patients? So as I said, we need to make a classification as to pigmentation, vascularity, fat, muscle, what is the problem. But classification systems are also quite handy to make notes in your files. It's also very handy if you're going to do research, and this is probably where we use it most of all. This is a classification system from a Dr. Dido, a plastic surgeon in 1980, but it's still used and cited so many times still in many literature. And this was actually a classification to plan plastic surgery treatments for the neck, and to look at whether it's a smooth and contoured neck, a class 1, a class 2. Is it excess skin that needs to be redraped or removed? Is it excess fat in class 3 that needs to be removed? Is it the platysmal bands that they actually plicate the platysmal bands? Is it a receded chin, or maybe an anterior highward giving you the short higher mental class? So 4, 5, and 6 Dido classification. So this is not the only classification system, but it's quite interesting because it can really help you a lot to explain to patients also what they need. Because I found, especially if I go back quickly to the Dido classification, patients come to you on referral of a friend, and they say, my friend had this type of laser treatment and it worked for her and the neck looks good, and can I also have it? And then sometimes we have to show them these classification systems and say, yes, but it's not going to work on you because your friend is a class 2 and you're a class 3, so you can't really have the same type of results. So sometimes we underestimate using these classification systems to explain to patients the severity and what type of condition they have. And this helps us in the discussion and consultation with the patient. So there's also a classification system on platysmal banding that I found from 2015 in the Aesthetic Surgery Journal by Dr. Gupta and colleagues that just shows the severity of platysmal bands. And this might be very helpful also in planning how many units of botulinum toxin do we need for treatment. Then there's also Dr. Lando, Marina Lando, that I know well, and her colleagues worked on some wrinkle assessment scales for décolleté wrinkles and décolleté pigmentation. So you can see there's really a lot of interest on the neck and the décolleté region for literature and for treatments, because it's a very big concern for patients. So then just before we start with the treatment specifically, let's look at the anatomy. And I think this is quite important for you to also understand the levels of treatment, especially if you're going to go to minimally invasive treatments, especially threads, to really have good knowledge of the layers. So we know, first of all, as I said, the skin on the neck is really very thin. And the platysma is just superficial. It's very superficial muscle. It's not a deep muscle. It's a very thin muscle. And it covers the whole neck area from the top of the chest. It covers the whole neck area and then actually covers the mandibular border, still very superficial, going to the mouth modiolus. And it's a very important depressor of the lower face. So this is a very important muscle to understand, that it's very superficial, it's very thin. And then deeper we can all remember from medical schools, it was a very good question, what is the anterior and the posterior triangle of the neck, and which are all the danger structures there? So as soon as you start with invasive treatments, you really need to understand the anatomy of this. So let's start with the rejuvenation treatments of the neck and the décolleté area. So what are the treatment options? So what is in our doctor's bag that we have to actually treat the neck and the décolleté? So the first treatment that we can look at specifically is peelings. And I've been using peelings very successfully in many of my patients with very good results, but I'll give you some tips and tricks on using peelings. Then we have our lasers, and lasers have evolved significantly. We cannot compare the lasers that we have of today to the lasers that we had many years ago. The same as we cannot compare a computer or a laptop or a phone of today with the technology that we had just 5 years ago. So we need to also be updated with this. And then we have the energy-based devices. So we have the HIFUs, the radio frequency, the ultrasounds, then photodynamic therapy. So PDT-ALA is a very good treatment and a very affordable treatment to use for neck and décolleté. Botulinum toxin, I'm going to describe what we can achieve with botulinum toxin and how can we achieve good results. Then fillers. Fillers is obviously not volumizing fillers that we use, because we never want to add volume for the neck, but very good for wrinkles and also to restructure the skin. Then skin revitalization and collagen boosters, a very important factor with very good results in the neck, especially for those vertical wrinkles, but also for that really what they call the turkey skin, loose skin around the area of the neck. And then for décolleté, we have a lot of wrinkles, especially from sleeping position, and that we often see very significantly in women with large breasts, that they form really deep wrinkles. And this is where we can really use these type of technologies. And then threads. Threads are very popular in the neck and décolleté, especially neck area. And often it's seen by patients as a very quick fix to just quickly pull back, because you often see if they do this in the mirror, it looks better. But you also need to really understand how to use threads correctly and which vectors to use. Then lipolytics. So lipolytics with devices or injectables, I'll discuss that, especially for the double chin area, which is the non-surgical options. And then obviously we can't forget all of the topicals. So the first topicals that we have is our prescription topicals. So the prescription topicals are the ones that we use especially for actinic keratosis and maybe for very early superficial basal cell carcinomas. And these we use especially when we start wondering about lesions in the neck after maybe biopsies or as a pre-treatment for deeper treatments. And then cosmeceuticals are used more in the neck and décolleté for prevention. And I think it's very important, the earlier that we can start teaching our patients to use their very expensive night creams or prescription night creams on the neck and décolleté, the more we can help them also to prevent the aging process. Okay, so let's start with the chemical peels. Chemical peels has got many benefits. It's very affordable. I think that's the very first and most important thing. It's available for all doctors. You don't need to invest a lot. You don't have to buy a very big device, and we can get very good results on skin roughness. It reduces photoaging signs. It improves the overall skin appearance. It can also be used for skin lesions very specifically, and sometimes we use a medium depth chemical peel on specific lesions, and it has a lot of preventative benefits. So I think the first and most important thing about chemical peels is that if we're going to treat the face, never forget to treat the neck and the chest area also while the patient is there. So start as soon as possible. Now, repeated superficial peels are suitable for all the skin types, and it's safe for all skin types. But we have to have caution with medium depth peels, especially in pigmentary risk skin types. And also remember in that very thin atrophic skin that we need to be very careful with medium depth peels because we need reepithelialization. And if we have got poor reepithelialization in that area because of atrophy, no hair follicles, no pores, then we have this risk of delayed healing, prolonged erythema, and that can lead to either hypo or hyperpigmentation. So be very careful in those type of patients. Then lasers and light, and we have various types of lasers and lights. So we have our ablative fractional lasers and lights. Then we have our non-ablative lasers and IPL for skin rejuvenation. Then we have our vascular lasers for telangiectasia, poikiloderma, and then like the small plasma laser for skin tags, which I'm demonstrating in the video here. Let me just put the sound a little bit off. So ablative fractional skin resurfacing is used specifically for wrinkles and very severe sun damage. Non-ablative lasers and IPL for skin rejuvenation is very successful in reducing red-brown discoloration. And it's a safer option, but remember to be very careful. As I said, the most significant burns that I've seen from IPLs is on the chest area. And then as soon as we see vascularity, we see poikiloderma or telangiectasia. I've seen patients with a really significant telangiectasia on the chest. Then we need to bring in our vascular type of lasers. And that would be your 1064, especially in darker skin, 532 more in the fair skin type, so your KTP lasers or the pulse dye lasers. The plasma lasers is very, I love to use it for skin tags in the neck because it's very precise, it's very small, but it's also used, and I'll show you now a study also, for tightening the skin on the neck. But there again, be very cautious and don't be too overzealous with treating too deeply. Okay, so let's look at some studies and evidence-based medicine, starting first of all with the different types of laser treatments. So here you can see the first picture is a study de Bernardo, the two de Bernardos. They did a study in 2018 utilizing a 1440 nanometer side-firing laser with a type of skin tightening. Then the picture at the bottom here is Dr. Grunebaum, Kaufman et al. And this is a 2790 laser resurfacing. So this is a fractional ablative laser resurfacing for photoaging. Obviously, there's more patients in the study, but these are the types of one that you can see the results. Here is a study on the plasma exeresis. So this is, but combined with a very low non-cross-linked hyaluronic acid injections. So this is the plasma lasers that is also more affordable than lasers. You can see it's quite significant recovery period. It is painful procedure, but good results, but also here not suitable for all skin types. So make sure that you take that in consideration. Okay, then fractional lasers. So fractional lasers is used really a lot on the neck as well as the chest area. And here you can see from the studies from fractional picosecond, fractional ablative. So just, I do a lot of fractional lasers in my practice. And I think the one message that I would really give out is rather go with lower settings and make sure your pitch, so the density of your fractional zones are not too close together, because we need reepithelialization and healing. So make sure it's not too close together, and rather do multiple sessions, 3 softer sessions than 1 intensive session. Because otherwise, first of all, you will get complications. And second of all, you don't get the results that you get on the face with like double, triple passes and going too intensively. The neck can just do so much healing that the microcirculation of the neck, the dermal appendages really restricts that. So make sure that you take that in consideration and don't be too over eager to go deep on the neck and the chest area. Rather do it in softer sessions. So if you do with your specific device, usually 3 or 4 or 5 passes on the face, then opt for 1 or 2 passes on neck and chest, and tell the patient to rather come back for 3 sessions. And your results will really improve significantly, and your type of complications and also the side effects that the patients experience after procedure is so much more on the neck and the chest than it is on the face. And I've seen so many times patients coming back after ablative fractional procedures, they say, it was really good, I could tolerate it, but my neck and chest, it was just too irritating. The healing was giving me sleepless nights. So don't overtreat the neck and chest, rather do in multiple softer sessions. Okay, then we get to skin tightening, and there's a lot of people that always wants to tighten the skin of the neck. So, and we have many different energy-based devices for tightening the skin. So also your fractional lasers will help a lot for tightening the skin, but then we have other non-ablative energy-based devices. So we have radio frequency, monopolar, bipolar, tripolar radio frequency, and there's really many good devices on the market. The first picture at the top here is a patient of mine after thermage treatment. I have to say also it was a session, and a year later another session with this type of results. Very good results, very safe on all skin types. And then there's also some pictures on the ultrasound. We have the high intensity focused ultrasounds. We have the micro focused ultrasounds. We have infrared laser tightening. So there's many devices on the market. I haven't even mentioned everything. And I think it's a really good tool, and especially in combination with other treatments. Okay, then PDT-ALA. Now, PDT-ALA is a really treatment that works really well for neck and chest rejuvenation, especially in fairer skin types. I don't really use it so much in skin type 3 and upwards. First of all, because it's very risky, because there's a lot of inflammation, and we know inflammation leads to pigmentation. And second of all, skin types 3 and upwards don't have so much UV-induced damage as the fairer skin types 1, 2, and 3. So they don't need it as much. But there are many, many studies. I've mentioned 2 studies that I've mentioned in here, but believe me, on the neck and the chest, there's multiple studies. I think it's one of the technologies that have got so many scientific publications, you cannot even read all of them. So what basically I refer to with photodynamic therapy with ALA is, so we use a photosensitizing agent to actually then get absorbed into the skin, and it gets absorbed into fast mitotic cells, so usually into damaged cells much quicker than into normal cells. And then we expose it to the PDT or LED light. most of the time red, but there's also many studies with the red and blue light that you do exposure. And then you get this phototoxic reaction. Now, PDT-ALA is something that really works very well for patients with actinic keratosis and where you can really see those years of sun damage. So the skin just looks leathery and sun damage. It's quite an affordable treatment, but it is quite a painful treatment for patients. So you need to give them pain medications. I've done I don't know how many thousands of these treatments because I live in South Africa. We have a lot of sun. We have the whole year of sun and the people love outdoors. So PDT-ALA is a very popular treatment that even the medical insurance pays for the patient. So a very popular treatment here. So also here you need to take in consideration the chest will take longer to heal than the face, but I haven't seen any non-healing or prolonged erythema as I've seen with lasers because PDT-ALA is more working on like a healing type. It heals the sun damage and it's also used for many cancers and even for post-radiation dermatitis from breast cancer. So much more on a healing side, but remember, as soon as you add a photosensitizer, you do have that phototoxic reaction. So PDT refers, photodynamic therapy usually is referring to the fact that we add a photosensitizer. If we just use light alone, LED, it's usually spoken about as LED or low-level laser therapy, and not so much photodynamic therapy, although many patients, the doctors talk about PDT without photosensitizer, which is also quite correct. So just make sure that you understand that. Okay, then we get to botulinum toxin. So botulinum toxin is used then for platysmal band relaxation. And this is something that works really well for those patients that I described with the typical platysmal bands. And also to relax this really strong depressor of the lower face, which is the platysma. So here are a few of the studies. Also, there's multiple studies. I just wanted to show really the evidence-based medicine behind everything. So that's why I included some studies for you to read up to show that it's really a very effective, safe, and well-tolerated treatment of platysmal bands. As you can see in the video, you need to make sure that you grab the platysmal bands. The risk of dysphagia is injecting too deep and very high dosages, but mostly with too deep injections. So if you really target the platysmal bands, you are very safe. So I'm also going to show you a nice study with the very good results and the recommended dosages, but it's really not a treatment that we have to be so afraid of, because I know a few years ago, a lot of doctors were saying, I'm afraid of it for dysphagia. It's a severe side effect and it's a very rare side effect. And it was really seen more in doctors before a lot of training and cadaver dissections was done in the aesthetic industry, but we don't really see that so much anymore. Okay, so the technique of injection. So this shows a very nice study from Dr. Usher, not actually Dr. Usher, it was international consensus recommendation, but Dr. Usher also has a study on it, where they are talking about Spaywood units. So it's abobotulinum toxin A. And what you can see here, the recommended dosage is then from all of these authors concluded that 50 Spaywood units per side of abobotulinum toxin, so it's not ONO, so it's 5 to 10 per point, and this is spaced every 2 centimeters apart. So what I usually say is look at the length of the platysmal band in the patient and then determine how many dots. So you mark out how long it is and you mark out 2 centimeters apart, and then you can determine your dosage that you're going to use. The anterior bands are usually the most prominent. In some patients, the posterior bands are more prominent. So I don't easily go more than 50 units in one session. It's really not because of side effects so much of dysphagia, but more that patients can feel slightly weak, especially if they do exercises or suddenly they feel tension in the back of the neck muscles or abdominal muscles, which is always actually a good thing. But we can see the results and it really works. It's amazing results on these platysmal bands. There's other different techniques also of using botulinum toxin for the neck, and for the neck area we obviously have the Nefertiti neck lift, described first by Dr. Philip Levy from Switzerland many years ago, where we actually do also the platysmal band, but where it crosses the jawline, where you do 3 to 4 points, 2 centimeters apart, and then sometimes also anterior band, or some authors have actually described also doing another point here. And this works only if you want to have a better differentiation between the jawline and the neck. And then there's also what they call the Mesotox or Mesodisport, Mesobotox, where you do a very hyperdiluted botulinum toxin, a very superficial intradermal, because you can go and do it deeper now, but intradermal all around the neck and chest area to rejuvenate the skin and to reduce the wrinkling of the skin. And it's also an off-label use in most countries, but very popular also to mix it with some of our skin revitalizing solutions that we can multivitamin and free hyaluronic acid solutions. I have really good success in my practice with it, but very important to remain intradermal to get this type of safety and results. Okay, then we get to fillers. So fillers also, as I said, very popular, first of all for neck wrinkles and then also for décolleté. I have to say I really like cannulas for the neck and décolleté because you can spread the product more evenly, because the biggest complication that we have with fillers, so not your free hyaluronic acid, but cross-linked hyaluronic acid, is that you see those pools of fillers all along the lines. So cannulas work really well with fillers to actually distribute it. So put it inside the wrinkle, a little bit above it. So almost like a fanning type of technique using a 25 gauge cannula. And on the chest area, especially if it becomes very atrophic and very skinny ladies, also don't just work on the wrinkles, but fan that whole area to kind of cushion the skin there to treat that atrophy. Because we know that hyaluronic acid fillers also stimulate significantly your collagen and elastin production. So make sure you get it as close as possible to the dermis and that you really spread it all over the area. Okay, so that's for the fillers. Also, there's multiple studies on fillers for the neck. So this is just one of them, the treatment of horizontal neck wrinkles with hyaluronic acid filler and to see the improvement. And this is quite important to explain to patients that the results actually get better with time as we start seeing new collagen. So it's not as with fillers in the face where you do the lips or the cheeks and it suddenly looks good. They stand up from your examination chair and they look better. It looks better, but it improves a lot over time. And this we see from many of the studies. So give it some time. Then one thing that you can really not forget about in the neck is the skin revitalization and the collagen boosters. So skin revitalization is something that I add to all my neck protocols, whether I'm doing peels, whether I'm doing lasers, whether I'm doing even lipolytic type of treatments. This is something that is really very important to remember in the neck area. So here I'm using a device, it's called the NanoSoft device. It's a device that helps you to be intradermal with a polycomponent mesotherapy product containing multiple vitamins, minerals, and free hyaluronic acid. Because if I had to use crossed hyaluronic acid in this way, the pills will stay there. This is one of my most popular neck treatments in the face. Sorry, it's going on over to the eye area. I thought it was just a neck video, but just to show how superficial the device, and very good results, and also multiple studies to show its efficacy. So this is some of my patients that I've treated with a specific protocol with this product, with a NanoSoft device to see the type of results on the skin texture. Already that turkey neck has improved, the wrinkles on the neck has improved, it improves the lines, hydration, and also a lot of studies to show this. So I don't use this only as a treatment for a patient coming for neck, but also adding it to all my other neck protocols, because we want to make sure that we get the skin, the whole biosphere of the skin and the neck and the décolleté in a healthy condition. So I use it typically a week before fractional ablative lasers and also a week after. And that has given me significantly better results. It improves the healing also of our fractional ablative lasers. I combine it with peelings. I combine it even with thread procedures because threads is going to tighten, but we still need to get the skin to be in a better condition. So really something that you need to use in combination with everything. Okay, then with threads, I'm not going to explain in detail because it'll take long. So I've put a very fast video just on threads. The most common area of threads used is really to tighten the double chin area, where we use barbed threads in a hammock type of way to tighten this area. And then we use the restructuring type of the monos or screw threads to treat the fine little wrinkles. So just remember that you need to understand your device. You need to know how to use it. You need to have good planning. The neck is very prone to dimpling, so the recovery on the neck takes a little bit longer than it does on other areas, such as the face or body areas. Okay, but very good. Here's a study also. This is quite a nice study to read from Dr. Aurora that speaks about all the different techniques of thread insertion. You can see there's ways to put all of those restructuring ones in like a grid or a hammock. Then we have our free floating type of, we have our anchored, our barb type of thread done in very different ways. And this obviously requires more training to really understand which one to use and which indication, but very good results. And then lastly, we have obviously what we have is the extra volume. So a lot of people concerned about the double chin area, the fat pockets. And there we have our injectable solutions such as phosphatidylcholine and deoxycholate. It's always together in a solution, even if it says, but because it works, it's the emulsifying agent. But then we also have solutions with deoxycholate alone that has become very popular, probably because of a long-standing reputation of phosphatidylcholine. But in many of the recent studies, we can see that phosphatidylcholine is still the most efficacious one, whereas deoxycholate is also effective, but phosphatidylcholine added to it gives you more effective results. Cryolipolysis has also become quite popular. We saw all of these fat freezing devices entering the market, and then they added hand pieces specifically for double chin, so we can see it's a very big demand. Radio frequency also helps quite a lot for a double chin because radio frequency gives you almost like a three-dimensional tightening of fat and skin. So I spoke earlier about radio frequency devices, but remember radio frequency goes quite deep, so you can get quite a lot of fat tightening also, as well as our focused ultrasound devices. And then obviously the other option is then your surgical options of liposuction or minimal liposuction treatment. So this was quite an interesting protocol on neck volume reduction that I found by Dr. Francisco de Milo that showed his type of recommendation protocol of volume reduction where you first reduce the fat, and then after that you have to either tighten the skin or relax the platysma and then do tissue repositioning with the threads. And I think this obviously, there's quite a few in this article, there's quite a few protocols, but it just shows that we have to understand that combination treatment and working out a protocol for our patients is very important. And on this point, I really want to say that there are many studies that have shown the combination of treatments is more effective. There are split face studies or split neck studies, if you want to call it, that has shown combination is so much better. So evaluate and classify the specific concern, whether it's laxity, wrinkles, pigmentation, fat, vascular, muscle, and then combine your therapy because this really shows higher patient satisfactions, and then the doctor will also be very happy. So I hope I've left enough time for some questions, and I thank you with this. Dr. Santi, I don't know if the questions will be coming from you or from where.
Okay. Thank you very much, Dr. Riekie Smith. This is very interesting. Yeah. Yes, we've got questions from all the audience. So to all participants, participants, if you want to give questions to Dr. Riekie Smith, please write down your questions in the question box, and then I will read one by one, and then Dr. Smith will discuss it. Okay, for right now, we already have some questions from the audience. The first question is from Dr. Novi Valentin. Good afternoon, Dr. Smith. How is the safety issues using the laser treatment on the neck for pregnant women? Please, Dr. Smith.
Okay, so the safety issues on pregnant women is that I don't think it's different on neck than the rest of the body. You have to, first of all, know if the laser treatment is suitable for pregnant women or not. As for instance, really frequent we don't use on pregnant women. So I think in general, pregnant ladies, it's not going to be an issue of maybe delayed healing or pigmentation is maybe a problem because of the high estrogen levels. But most of the time, they don't opt for laser treatments or especially ablative laser treatments because you don't want to get to the point that you need to prescribe something that might be harmful for pregnancy. So if you wanted to do any type of laser treatment on a pregnant lady, I would go for a non-ablative option and not an ablative option. Yes, and then just keep in mind also the pigmentary risk.
Okay, thank you. That's we have to choose very careful for the pregnant women. Yeah. Okay. The next questions. So we've got from Dr. Regita. Good afternoon, Dr. Smith. May I know? She's asking about the Bionutri neck injection. You mentioned. On the neck, you give some injections on the neck area. Could you please explain what is the ingredients that is suggested for the neck area to make a rejuvenation?
Okay, so the Bionutri neck protocol is a protocol that is trademarked by Filmed Laboratories. It's a scientific presentation, so I can't mention the names, but it's a polyvitamin component containing all your vitamins, minerals, and then it contains free hyaluronic acid, 5 milligrams per milliliter. So it's 15 milligrams of hyaluronic acid that is then done in an intradermal fashion. So you have to make papules, and it's done all over the neck area, especially focusing on the neck wrinkles. But you can message me and I can maybe send you some literature because there's a very good scientific publication also.
Okay, thank you. And then for this Bionutri neck, can we do it for several times? I mean, after the first and then the next, maybe the next month? How many times we do this?
Yes, so the protocol has got very nice specific according to the age and the severity. In a young patient, you may be going to say, okay, let's do every 3 to 4 months because you have to start early. We do every 3 to 4 months to reduce the wrinkles and maintain it. In a patient with lots of wrinkles or older patient, you need to first do what I always say, damage repair. So maybe do 3 sessions, 2 weeks apart, and then go on to our maintenance session.
Yeah. Okay. So we, yeah, let's see another questions. Which one? No. Okay. This one is from Dr. Julia. What treatment or combination treatment that you usually use for to treat the neck area? So this doctor asking about combination treatment. Which one do you prefer, Dr. Smith, for the neck area?
Okay, so combination, you have to look at your patient. So if the patient, for instance, has UV damage, sun damage, then I would combine something like peels and lasers to really get rid of the pigmentation with the peels and the vascularity with lasers, like a 1064. And if it's like softer, non-ablative, you could do it in the same session. If it's maybe intensive, you're going to do it in separate sessions. So, like that. If it's maybe like a double chin, you're going to combine lipolytic, like reducing the fat, and then do threads to tighten the skin there. So the combination depends on what is the concern of the patient.
Okay. Talking about peeling for the neck, so what kind of peeling agent that you choose for the neck and decollete? Could you please explain, Dr. Riekie Smith?
Okay, so the most successful peeling agent for neck and chest rejuvenation would first of all be multiple superficial peels, like your gluconolactone and glycolic acid, and maybe a peel that contains a bit of depigmenting agents. So those are very good for regular use. If you're going to do a TCA, I would never really go above 25%, and it has to be a Fitzpatrick skin type 1 to 2. There's also some newer like retinoic acid type of peels, but be careful with a too strong peeling solution on the neck and chest area because our healing is much slower in this area.
Okay, thank you. And then if we're using thread for the neck area, after using the thread for the neck area, is there any contraindication that we cannot do treatment with with energy-based device like RF or HIFU? Do we have to wait for several months and then we can use the base device? Could you please explain about this?
So with threads, you cannot do radio frequency and the focus ultrasound, especially over the area of the thread. Usually it depends because there's a lot of different opinions, anything from 2 to 6 months. So there's a lot of different opinions on that. So what I do sometimes is I really mark out very carefully where the threads was placed, and you can do the treatment just above it and just below it because you're not right on the thread. But then you need to be very precise and take good photographs and make sure that you avoid that area. So because threads is not all over, unless you put multiple ones, then I would just wait out the area or maybe do those energy-based devices before the threads.
Okay, thank you. Yeah, we've got another questions now from Dr. Maria Angelina. Hello, Doc. On aging skin, should we do filler and thread on? Sorry, wait. Should we do filler and thread on skin laxity problem? It means combining filler and thread for skin laxity. What do you think about this?
Yes, it's actually a very good idea for skin laxity. So to use threads to redrape the skin, and then to use the very low cross-linked hyaluronic acid fillers to improve the collagen lesson over the whole area. So I often use the combination. I often do it in the same session where I first do the threads and then take with a cannula, and then really you want, as I said, you want to try and put the filler not just in the wrinkle but over the whole skin area to get collagen stimulation, because hyaluronic acid threads fillers are very good at stimulating collagen, so it's a very good combination.
Okay, so so thread and filler can be done at the same session. Do you mean can we do at the same session?
Session or in separate sessions, but there's no contraindication to do in the same session.
I see. Thank you. And then we've got another questions. Now, Dr. Maria Angelina asked, how about using stimulator as in PLLA or calcium hydroxy acid on neck and chest area? What do you think, Dr. Smith?
Yes, I still wanted to add that study, but there's quite a few studies also on our calcium hydroxyapatite in the neck and chest area. So also to stimulate collagen. So it's usually done in a hyper-diluted method, similar to how you would do your very low cross-linked hyaluronic acid fillers. And also this has been proven with studies to also give you improved collagen stimulation. And then the PLLA threads, it depends on your design of the threads. If it's your anchoring type of threads to help for like the double chin and tighten it, usually that you have to combine a little bit with other treatments to also get the whole skin to tighten, because usually the PLLA, if I think of the ones that you maybe are talking about, usually is only done 2. And remember, the neck is a very big area, so that's why I like to combine it then maybe with those skin revitalizing injections to make sure that we treat the whole skin.
Okay, thank you. And then the next question. Now, good afternoon, doctor. How many units of botulinum toxins that we need for injections for each patient? Maybe if I'm not wrong, I think she's asking about botulinum toxins for neck platysma on the neck? Or is there any other technique for wrinkles? I mean the horizontal wrinkle using the botulinum toxin. Could you please explain about this, Dr. Smith?
Yes, so I explained the two techniques in the presentation. The first one is in the platysmal bands, where if you take botulinum toxin, then you take every 2 centimeter on the platysmal bands, 5 to 10 units. I usually prefer 5 units. And you do it in the band, and you need to grab the band and inject the band to not be too deep. The other one that I prefer to use, especially for the horizontal lines, is then the off-label, what we call the Mesotox. So it's using a mesotherapy type of free hyaluronic acid solution combined with your botulinum toxin, which is then injected intradermally. So not intramuscular, but intradermally, into the wrinkles and also the whole surrounding area. And really something that there is publications on it, and many of the doctors will tell you have really good success with that. Okay.
And how many units do you use for the intradermal Botox on the neck area in one session maximal?
Okay, so what I use is the mesotherapy solution that I use with the vitamins and hyaluronic acid is 3 milliliters. And then I add 50 units of botulinum toxin. So that botulinum toxin is like your azulure, Dysport, those type of botulinum toxins that I add into the 3 ml solution. It's not supported by any of the companies, but many doctors are doing it. So, and then using that whole 3 milliliter for the neck and decollete area with very good results. But make sure that you see papules like you do for hyperhidrosis. So you do it that way, very superficial, and then it's very safe.
Okay, thank you. We've got another question. This will be the last question, yeah, because we're running out of time. From Dr. Ubeta, is it better using non-crosslink HA or crosslink HA to inject the horizontal neck wrinkle?
I think it's good to use both. So what I do in practice is I would tell my patients to do the non-cross-linked hyaluronic acid at least every 2 to 3 months. So that would be like your mesotherapy solutions. And it's very good if patients can come for that every 2 or 3 months. It's very safe. It's not so expensive. Do the whole face and neck area. And then as soon as you use a cross-linked hyaluronic acid, but low cross-linked, you do that once a year, or maybe a very older patient, maybe every 6 months. But usually the one that I use once a year, that you do inside the wrinkles. And I prefer a cannula for using that one, not to get those typical pills that you see all around. So it's always better if you can use a bit of both.
Okay. Yeah. Dr. Smith, we've still got one question again. This is from Dr. Regita. Doctor, just now you explained about mixing HA and botulinum toxins. Could you please explain about the dosage, about HA and the botulinum toxins for the neck?
Okay, so again, just saying this is my personal experience, but also I know many other doctors using it. So what I use in practice is a solution that contains 15 milligrams of free hyaluronic acid, non-cross-linked, in a 3 ml solution. So it's 5 milligrams per milliliter in the specific solution that's got added vitamins in it. And then I add 50 units of botulinum toxin. So that would be, in my country, we use specifically Dysport inside the vial, and then doing it all over the neck and chest, intradermal, not intramuscular.
Okay, thank you very much. I think, okay, this is enough because we're running out of time. Okay, thank you very much, Dr. Riekie Smith. We've got lots of talk, lots of discussion about how to rejuvenation the neck and decollete area. Yeah, before we close this session, could you please give some conclusion or take-home message for all the doctors here, for the participants? Please, Dr. Smith.
So thank you, Dr. Santi, and thank you to Iswam and to all of the participants for your wonderful questions. I'm really happy to interact with you. It's a pity we can't see each other. Let's hope it will get better and see each other very soon. If you still have any questions, you can always message me on social media platforms. It's so easy for us to stay connected, and I'll be very happy to interact with you again. Thank you very much for this wonderful event and for inviting me.
Okay, thank you. Once again, thank you very much, Dr. Riekie Smith, for your excellent presentation, and hope that after the pandemic ends, then we'll meet again. Maybe you come to Indonesia and become our speaker in the next ISWAM. Thank you, Dr. Riekie Smith. Stay healthy, stay safe. Success
Thank you.
always for Dr. Riekie Smith. Thank you. So
very much.
to everybody, all the participants, please stay tuned in ISWAM Virtual. After this, we will continue to the next speaker. Okay.
Dr. Santi.
Hello, all participants of Virtual Iswam 2021. Okay, we're still in the 16th session of today. So we're still talking about the role of neck and décolletés in aging. So for this last session, we will meet Dr. Lan Leong Chung from Malaysia, and we will discuss about how do the long-term results for with double pyramid threads in the neck for a 1-year study. Okay, let's welcome. Dr. Lan is already here. Hello, good afternoon, Dr. Lan Leong Chung.
Hi, nice to meet you all again.
Hi,
So
yeah, okay.
today I'm going to show you all the video presentation of the Turkey neck correction with this ultrasound PDO thread. So we know that the Turkey neck or Platysma band, there's a two theory behind. So one is, of course, is a skin laxity, especially for those aging sign, for those more than 50, 60, or 70s. But the other type of this one, the Platysma band will be the overactive or the muscle. So two of them is totally managed differently. Like what I think Dr. Riekie's presentation is more towards the device and the injectable. So my topic for today, I'm going to talk about the ultrasound threads. How we going to do this laxity neck correction.
Okay, very nice, Dr. Lan. So before you start your, before you start your video, may I briefly read your CV first? Yeah, before, just a few seconds. Okay, for Dr. Lan Leong Chung from Malaysia, he's the managing director of Global Group of Companies and a medical doctor, founder of Clinic Central, and he's the key opinion leader for advanced thread lifting. And also Dr. Lan is the key opinion leader for Helen and Alganese injectable fillers. And you already know that Dr. Lan Leong Chung has been our speakers in last ISWAM. So to Dr. Lan, please, you may continue your video and presentation.
Thank you. Thank you. So today I'm going to show you this video presentation for the age of 74 years old. So if you look at the entry points, there's two entry points on one side. It means we're going to put a pair of the threads. If you look at the exit point here, this is the exit point. So highest point usually is close to the chin area. When you try to bend down the neck, you can see there is the margin here. That will be the lowest point. So one thread, two thread, mean one pair on each side. We try to have an entry point, which we actually can fix as this very important two ligament. One is a platysma auricular ligament. The other is a cervical retaining ligament. This is how we actually try to fix at this area, pull most of the soft tissue, fix to a certain part, and then tighten it out to keep for some times. So assessment and the marking is always the most important. This is what we mean the upper point. This is a lower point. Two entry point from behind the ear. Try to pull back all the soft tissue. So in this case, we are putting one pair on each side, mean two threads on one side. So for all the threads procedure, the sterilization is really important for us. So I usually prefer to use a Providence or iodine, 10% plus the alcohol 70%. This is a pre-mixed solution. It's available in the market. So why I prefer this one? Because the color-wise is definitely is not so dark, easy to keep all the marking and we can see clearly. And of course, all the hairline, whatever area surrounding, we really need to clean it in the proper. So this is the most important part. We actually to avoid the complication. Is most common complication, I think, for the thread is the infection. So the sterilization part is really play a very, very important role. So thread with the clean towel, all the entry point and exit point, we basically need to put the lidocaine. The local anesthesia. If you have the lidocaine with the adrenaline, it's more preferable. So some of the practitioner, they don't put the local anesthetic along the injection line. For me, I more prefer to actually to put some of the tumescent solution along the injection line. So only the entry point and exit point, we put the local anesthetic. Along the line, we are going to put on this tumescent infiltration by using the 20 gauge cannula. The tumescent, the percentage, you use lidocaine 2%, we add on the sodium bicarb with the adrenaline and normal saline. These two small hole, we actually put the entry point here because the cannula itself is not as long as the whole line. So we need to create another 2 hole here so that you actually numb the whole neck area. Basically, the whole procedure is not really painful. The problem is when we do the neck region, we want to make the patient more comfortable after the procedure. So I more prefer to actually to numb the whole neck area by putting about 2.5 to 3 ml of the tumescent solution along the line that we had drawn. So this is how we go in with the 20 gauge cannula, 70 mm. So again, we are targeting these two, platysma auricular ligament and cervical retaining ligament along behind the ear here. That is the fixation point we try to fix. So to avoid any dimpling, I more prefer you to go in perpendicular, then only you start to turn slowly. So what is the plan is very, very important for the neck region because at this laxity neck, the tissue actually is quite thin in some of the cases. So we try to keep as superficial as possible, but never create any dimpling, just exactly the subcutaneous plan. And if possible, try to catch some minimal amount of the platysma fiber if possible. But I know that the platysma muscle is really thin, so if possible, you catch some soft platysma muscle fiber, you have a better result. If you are putting this thread too deep, you might not have a long-term effect. So I more prefer you keep just exactly the subcute area. So this is the first thread we insert in. Second thread, always go in perpendicular, then only you start to turn. Once you had numbed the whole neck area, basically you have actually quite easily to do it. You can do it slowly. Patient don't feel much of a pain, usually no pain at all. So come up exactly at the top of the band. So this is the second thread. One side we're using 2 pairs. This thread basically is come with the blunt conical cannula, the needle, which is less traumatic, will cause less bruises. I would say seldom you can cause any bruises at all. So for all the tightening part, after you finish one side, patient need to be at the sitting position. Then you start to tighten the whole thing, push all the tissue to the back of the ear. So make a tightening. So again, we repeat on the left side. So the same thing, first thread on the left side, go just below just as the subcute area. If possible, catch some platysma fiber band, but try not to create any dimpling too close to the skin. Always target partially these 2 fixation points. You have to catch both the auricular platysma band and the other is a cervical cutaneous ligament as a fixation point. So once you have done This is the most important part. Your finger must really fix it, pull the thread, tighten up the thread, and then slowly you have to pull the skin upward, tighten up the skin upward so that all the skin will catch along that thread. So once everything done, you have to trim it. And this is how actually we are releasing the dimpling at the exit point. Try not to push the skin down as what we're pushing on the face. For the neck area, because the skin is really lax and then a bit thin, the best way actually we call it as using the pinching technique. We just need to pinch a bit so the dimpling will go off by itself. So try not to push the whole skin downward. Actually, it will set down. So this is the immediate result that we can get immediately. So this is a before photo with all the laxity. We try to pull all the skin, tighten it up behind. This is a thread having, I think, a lot of the bars actually can fix the soft tissue, can hold it for a longer period, and then all the tissue we try to move at the side way. So this is an immediate before and after. Front view. 6 months later, this is a 6 months photo that we can see with last year done in the November. This is a May. 6 months later, you can see the effects are really tremendous. Of course, in between, we do have a 2 section of the laser tightening effect, laser toning section for him. And then this is a final result after 6 months. So yesterday we just took another photo at home. This is a 14 months result. 14 months patients still keep quite well. Of course, the band is started bad, but not as bad as before. So PDO thread, they have a 2 effect. One is the immediate lifting effect, at least for about 3 months. I would use the word at least 3 months. If you look at this, also the same. And then later effect, what we want actually is a collagen stimulation so that they have a more tightening effect later part. This is a phase 2. So if you look at this is a January to yesterday's photo, and this was in 2019 November before. This is almost a 14 months result. Okay, thank you.
and go.
Hello to all participants. So we've seen from Dr. Lan, yeah, what an amazing result that Dr. Lan has done treatment for the neck for his patient, yeah. And then we still have the next speaker. We will meet Dr. Inigo de Felipe from Spain, and he will also talk about the long-term results in threads for the neck area. So Dr. Inigo is with us. Okay, good morning, Dr. Inigo Felipe.
Good morning. Thank you very much for your invitation.
Yes, thank you very much, Dr. Inigo, for joining us here in virtual Iswam and sharing with us. So this afternoon, before you start your presentations, may I briefly read your CV first? Yeah. So Dr. Inigo de Felipe from Spain, education, medical school at the University of Navarra, in which he was student representative for several years. And then 1992, he finished his studies and completed his training at Harvard University in Boston and the Karolinska Institute in Stockholm. He then took his residency in dermatology and venerology under the direction of Professor Quintanilla in Pamplona Clínica, Universidad de Navarra. And work experience, Dr. Inigo de Felipe, since 2004, he's the medical director of Hedonei Centros Médico Estéticos, and today more than 40 in Spain and Portugal, thanks to its excellence and scientific rigor in treating patients. And at the beginning of 2007, he opened his own clinic at the heart of Barcelona, his usual residence, where the most advanced techniques are offered with cherished and patient-oriented medicine. So to Dr. Inigo, the time is yours.
Thank you very much. So usually the neck has been treated through surgery, but surgery has a long downtime and the results may not last as much as many would like. Several devices, several technologies have been used to tighten the neck, among them a radiofrequency. And as you can see, many years ago, all these devices with radiofrequency claimed that they could really lift the neck, and this is one of them. And I remember that 16 years ago, I overtook this technology of radiofrequency, so it was an outside technology to try to lift not only the neck, but other areas of the face. This technology was based on the cooling of the surface of the skin and the heating of the inner part of the dermis so that new collagen was synthesized and the skin was tightened. It was based in the fact that heating with radiofrequency could shorten the threads of collagen and the bundles of collagen. And in fact, when you see the papers and the research made with this, you could see that there were changes in the collagen bundles. But if you look at the details of what was the energy required to do this, you can observe that energies were quite high. In fact, as high as 130, 130, 140. And in fact, if you try this on a patient, you will see that it is very, very painful. It is not very feasible. It's not very realistic to work with such high energies. So sometimes scientific data making analysis assume preconcepts that are not realistic because we cannot work with such high energies. In fact, I overtook a whole project of research, and that was the matter of my PhD. And I worked with radiofrequency to see how much this could tighten not only the collagen, but also the neck. And in fact, we could really see that there was a reduction in the total surface of skin treated. And obviously, in a biopsy, we could see that there was more collagen synthesized here. As you can see here, In picture A, which is before the treatment, there is less collagen than in picture B or picture C. The problem is that once you translate that into real life, this scientific data is irrelevant because the patient cannot see the improvement. There is another technology with radiofrequency that works inside the skin and was precisely meant for the neck. As you can see here, all these pictures show the tightening of the neck. But if you see the picture on the right side, which is the after, you can see that there is a change in the angle of the thread and the angle of the neck. So is this really produced because of the effect of the treatment, or is it because of the effect of the picture? Because if you change the angle of the neck, you're going to obviously see a huge difference. So most of these devices, right, have some tricks that do not explain how they're working. So even if this is published, not always the results are realistic. And you can see fantastic results, but then when you treat them, as in my patient, you will see that there is no change at all. This patient, for example, was treated for the neck with radiofrequency, and there is absolutely no difference between picture A and picture C after 7 months. There is no tightening with radiofrequency whatsoever. These are pictures of the arm, and when I tried the same in our patients, there was absolutely no improvement. And my patients were systematically disappointed by the tightening of the radiofrequency. So that is why I started working with a thread. And the first dilemma, the first choice I had to make was what kind of threads to use. And I got to use the soft silhouette, or had I got to use the pyramids? Was it going to be cones? Was it going to be pyramids? What was the response? Cones are made of polylactic. They are supposed to last longer. And because the size is big, they are supposed to exert a very strong effect. These cones measure up to 1.3 millimeters and in length 2.5. But the problem is that the maximum number of threads we find is 8 plus 8, and that is not many. Anyway, I tried it on my patient who failed to improve with radiofrequency, and what I could see is that immediately after inserting the cones, there was an improvement, but after 1 month, there was absolutely no improvement at all. So I started trying the pyramids. Pyramid is a different concept. It is a thread that is reshaped so it can grab the tissue, it can grab the dermis, and it can bring everything up. Instead of having 16 cones, what we have is about 150 something pyramids that tighten all the skin. The way I work with them is different to Dr. Lan. Instead of inserting the threads on the side, I always insert them in the center of the neck, exactly from here, sideways. You can use 1 thread, you can use 2 threads, you can use as many threads as you want. You have to avoid the angle, otherwise you will mark the angle and you will produce that bundle there. So this is a good technique. This is also a good technique, the X shape. This is sometimes used to lift the very big mass that you can have underneath the skin. Other times, you use these threads in a parallel mode so that they're not really running across, they're rolling parallel to it. The very first thing I noticed in my first patient was the strong pain developed for a week after the treatment. And as you can see, the effect is immediate and is fantastic. So these threads really, really grab in a much stronger way than any other thread in the world. This is the second patient I did, and there was a strong effect from the very beginning. This was my third patient, and as you can see, the effect here is miraculous. There is nothing, not even surgery, that can provide this result. If you look from one side, this patient looks fantastic, and also from the natural side. This is another patient where I tried just one simple thread. And as you can see, even one thread is able to induce a wonderful effect. So as you can see, all these many patients, by inserting the thread in the center of the neck and moving sideways, laterally, these threads produce a fantastic effect of lifting. So why do we have this pain? Well, we have the pain because the thread is really lifting and grabbing the dermis. So when I ask my patients, can you describe the pain that you have? Well, they say that pain was almost excruciating by day 2 when you were using just one thread. So I decided to change my experiment, and I started using 2 threads and 3 threads. And when I asked my patient what the experience of pain was, the experience was a bit different. This is a patient that had 2 threads in a double-edged manner, always entering through the center. You can see the before and after, and you can see how the effect is marvelous, fantastic. This is another patient, and you can see that there is a lift of more than 1 centimeter from a lateral measurement. These patients improve much better than with surgery or, of course, with radiofrequency. So when pain was addressed, as you can see in the blue points, this is the line of patients that had 2 threads. So the more threads you have, the less pain you have. And obviously, the result is even better. Why does that happen? It happens because these threads have the enormous capacity to lift the neck properly. And when you use one thread, all the strength and all the heaviness of the neck is being anchored on just one thread. So the more threads you use, the more comfortable for the patient it is. If you decide to measure the exact pain experience, you can see that by day 2, by just doubling the number of threads, the pain feeling is halved. And when you see the overall number of adverse events, you see that there is no bruising, no extrusion, no migration, no granuloma, no scarring, and no infection. This series is a group of 72 patients. What happens when you use these threads in young people? Well, young people have very strong platysmas, so the effect is more difficult to be obtained. This is immediately after, and this is what happens, and this is what happens 6 months later. So the results after 6 months are very surprising. I would have never found a result like this with surgery or with other types of threads. So not only the mechanical effect is very strong, but all the process of new connective tissue being synthesized around this tightening thread is making the neck look much better. You can see here, immediately afterwards, and here, and how on the long term, the result is even better. There is a new synthesis of connective tissue, something going around that will improve this. So this is what happens in young people and older people. Obviously, people aged 30 to 40 years, they improve 0.7 centimeters in the profile. But if you go onwards in the table, the older you are, the better the results will be. because laxity is higher, is stronger, is more important. And if you look at what happens in the long term at 6 months' time, you can see that especially in the elder group over 60 years, the result is even stronger. There's a very strong capacity of old skin to synthesize with new fibroblast all these collagen bundles and connective tissue around the thread that is tightening. These threads are absolutely incredible in the way they tighten, because they have this effect immediately afterwards, but this is increased with time. So what happens after 6 months? This is what happens. The result is amazing. There is a flattening of the skin. There is a tightening of the neckline. This is what happens immediately after. But look what happened with this lady after 6 months. It looks even better because there is new connective tissue being synthesized around this thread. See here, this is immediately after with a very nice result. As you can see, the out point is on the lateral side. And this is what happens after 6 months. It looks better. This is one of the first patients I had. This is how she looks 6 months later. This is a wonderful result. And this is also 6 months later. And this is my patient, my very first patient that complained of the pain. And as you can see, after 6 months and after a year, she looked fantastic. So why does this happen? There is, first of all, a very limited number of infections. And this is very interesting because of the series of 72 original patients that I did, there was no single infection with the PDO thread. And why is this? If you look at articles in gynecology, you can see that in these columns you have lactic, polyester, polypropylene, polydioxanone. You see that the infection rate, that's the fifth column here, let me see, there is 0. There is absolutely no infection at all. This is very interesting for PDO. And I think that PDO is a great material to make threads. It lasts a long time if the threads are cut by ultrasonic technology. And also it protects you from having infections. The second thing, why do people improve at 6 months? Is a PDO a collagen inducer? Well, of course it is. It has been published in the past, for example, with the Happy Lift threads. The guy's or the physician's global assessment of 6 months is always better than immediately after. So there is an improvement through time. And this is one of the pictures where you can see that the thread might disappear, but there is new connective tissue inside. This could be shown even with ultrasound. Polycaprolactone is another material that is a very good stimulant with these threads in order to induce a better result in the long term. And if you see what the literature has published about the long-term effect of lifts and threads, you can see in this study how they compare the apparent age with the real age. So for example, this patient in the upper picture is 29 years old and down she is 31, but apparently she looks younger. So at the initial point when we haven't started yet with threads, the apparent age and the real age matches. But as you come on and you do procedures, this is what happens. The apparent age is lower than the real age. Thank you very much from the team in Spain. I hope that it has been interesting for you.
Yeah. Okay. Thank you very much, Dr. Inigo Felipe. What a great presentation. Now we have a complete information from Dr. Inigo and Dr. Lan. To all participants who wants to give questions, you can write down your questions to the question box and then we will have a discussion. I will read the questions. Once again, to all the participants, you can write down your questions to the question box, okay? No, okay. So I would like to ask to Dr. Lan. Dr. Lan, you give the thread for the man over the 60 years, and Dr. Inigo also mentioned that the thread for the neck will give the good result for people that is elderly. So concerning safety for people over the 60 years, they might have cardiovascular problems and they get aspirin. What do you suggest that we should give for the anesthesia before we do the thread? Please, Dr. Lan.
I think regarding to all those medical issue for the thread procedure is really safe. For those who are taking the aspirin for the blood thinner, I usually stop the about 3 to 5 days in between. So to stop all the vitamins that supplement they are taking. So for at least 3 days, if possible, 5 days is always the best, just to actually to reduce the bruises. But all this depends on what procedure we are actually doing. Like this neck procedure, basically not much of bruises you can create because by this thread, they actually come with this conical needle. Hardly you can hit any of the blood vessel if you're doing in the proper way. So if you say the cardiac, especially with those local anesthetic, there's no toxicity at all. It unlikely go to the systemic because of the minimal amount of the lidocaine. So even just now the case I show, actually he is on those aspirin habits as well, and all the cholesterol, anti-cholesterol medicine. I think there's no issue to proceed because this is just a minimal invasive procedure, and then the less bruises, especially the needle design. So, but for the safety issue, all the aged patient, we do proceed with the ECG beforehand for the safety issue. The other thing is we always have the proper history a week before. If they really have any blood thinner medication, we always advise them to stop.
Okay, thank you, Dr. Lan. Now we've got another question. Now this is from Dr. Regita. This one is to Dr. Inigo. Dear doctor, what kind of thread that you suggest for neck rejuvenation? Dr. Inigo, maybe you can explain more detail about the thread for neck. Please,
Right.
Dr. Felipe.
Thank you very much for the question. The threads I use for the neck are either PCL or PDO. They're both used. Double fixed pyramid. So there are the thin ones, there are the thick ones. I always use the thick ones, and I use from 2 to 4 threads.
Okay, 2 or 4 threads. Okay, yeah. And then we've got another questions now from Dr. Maria. Doc, due to its structure, neck is quite challenging. If the thread go over the muscular of sternocleidomastoideus, yeah. So would you please explain about the technique? So to prevent, yeah, is there any kind of stiff movement while using the thread for the neck area? So concerning about danger area at the neck, please explain, Dr. Inigo, maybe.
All right. The shape of the needle helps in avoiding entering into the muscle. And this is a very interesting feature of the needle because it's blunt. It's not very sharp. So you have to think as of a knife inserted into butter. When you put the knife, it usually finds its way through the fat layer, the dermis and the fat layer. It's not all that easy to inject in the muscle. So when you're inserting the thread, you immediately feel the resistance and the strength of the muscle. So you just come out and then you continue going through that lane that is very soft.
Okay.
Dr. Lam?
Yep. I think if you have any resistance on the procedure, you should stop it, because if you are in exactly the right plane, the subcutaneous plane, there usually not much of resistance we go about. If you look at the previous video we show you, usually the procedure should be really soft and smooth. If you are handling like struggling, definitely you are not in the right plane. Either it's a too superficial, you're catching the subcute area above the cutaneous area, so you will feel quite difficult. Second part, of course, you go too deep on that. I think the latest design of the thread, you just need a rolling method. It's really soft and then smooth to go about that. Due to the non-cutting design of the thread, I think that will be the best thread we actually suggest to use for the neck, especially a lot of important structure.
Okay, Dr. Lan, when we're doing the thread, the pyramid thread, can we do pull it back if we have difficulties when we get through the thread, or we just go straight forward? How do you explain this?
This pyramid thread, we encounter a very big issue. That's quite difficult. Once the thread already gone into the tissue, it's very, very difficult for you to reverse it, because there is a lot of the cone pyramids there. So we advise you, if you want to check whether your plane is right or not, before you pull out the needle from the skin, you have to already check it, make sure it's really in the subcute. Once you pull out the needle, the thread already catch the soft tissue. There's no way you are going backward. So if you are really at the wrong, you already come out what you need to do. You really need to waste a thread, cut the behind, and then pull all the way from front. Not the reverse way. Not possible. Yeah.
Okay, I see. And then we've got another question. Doctor, should there any kind of adverse effect of neck movement after using the thread on the neck area? Maybe Dr. Lan, please explain about this.
I think like what Dr. Inigo said, most of the cases, their complaints, the pain is the major issue, especially the neck thread procedure for the first 3 to 5 days, as compared to those monofilament threads for those for the neck wrinkle threads, totally different. This is really because you are catching the soft tissue and really pull all the way back and hook of the behind the ear. So I think you will say the side effect, I say movement-wise, definitely there's no issue, you're turning neck or whatever, but when they start to yawning, they really feel the pain and pulling. But that usually lasts for about 5 days maximum. What do you think, Dr. Inigo?
Please, Dr. Inigo.
Yes, I completely agree. I've had threads and I only felt the pain when I was doing exercise, right?
Okay.
From here, right? So the less you move, the more comfortable it's going to be. But it's absolutely tolerable, absolutely tolerable.
Another issue, I think most of the comments from the patient was that the line, when we pull too tight, they will have a very, very obvious tightening effect, which is not should call as natural look for the first 1 or 2 weeks. That has to be explained to the patient for the first 1 or 2 weeks. Usually because of the tightening effect, patient always feel not comfortable. This is one thing. Second, not natural. But of course, after the 2 weeks onwards, the patient feel much better. So I think this is a 2 issue. I won't call as a side effects. I would say majority of the patient will comment on that. First is a pain. Second is unnatural because of 2 tightening effects.
Okay. And then I would like to ask if there is any dimple after we insert the thread, how long will it disappear after we insert the thread? If there is any dimple, usually patients complain about dimples. How long will it last? How long will it disappear? Please, maybe Dr. Lan or Dr. Inigo.
I start first. Maybe Dr. Inigo start first.
In my technique, where I use a central point of entry, if the threads don't go very, very parallel together, they are a bit separated, they can produce an indentation and a dimple. So you have to be careful to insert and use exactly the same tunnel with both needles. If you don't, there is an obvious dimple that might take up to a month that you can see, but that dimple disappears completely. And it is a very good sign that the thread is really pulling. And this is important. This is a very important message. I've been working with many threads. This is the only thread whose dimples last, because this is the only thread whose effects last long term.
Okay.
Maybe I add on some points. This thread we have two issues, the dimpling. One is in the entry point, and the other, of course, is the exit point. So I'm not talking about only the neck, especially the face. So like what Dr. Inigo said, if you want to avoid those entry point dimpling, both the thread you have to go in perpendicular before you start to turn. If you at the right plane, and then once you enter the subcute, then you start to turn the direction, you won't create the dimpling at the entry point. But the most important, actually, the face exit point is always make a lot of the issue, especially if you're using this very strong thread. If you think this holding too tight, and most of the time, if patient you send back with a very nice face on the first and second day, they might come back after 4 days or 5th day, they'll tell you actually dimpling start to appear. Yeah. This is why, because once the thread is holding up, when you have a movement, talking, moving, actually the tissue will move up and you start to hold again. So it moves upper and upper, so you might have a dimpling later after few days. So if you have a dimpling, I will always suggest the patient immediately, all the practitioners must release it immediately on the same day. It's much more easy because you already have the numb. You already put the local anesthetic. Patient don't much pain when you release it. But in the future, if the patient come back after a week, it's actually quite difficult for us to release a dimple. You need to inject a bit of the local anesthetic. So like what Dr. Inigo said, it lasts for a month. I have a case with during the training, we purposely keep the dimple and see how long it lasts. Actually, it lasts about 3 months, almost 3 months. It's really, really hard. So if your patient have any dimpling to come back after a week, please release it by subcision. I think especially on the entry point. Yeah.
Okay. Yeah. We've got another questions now from Dr. Maria. Can we use the same method? Yeah. Can we use this this one? Yeah. Wait. This bawahnya lagi. The other one. Yeah. You mentioned that there was 2 types of size for this pyramid thread. For young patient with double chin complaint, can we use the same method as in old patients, considering skin laxity? And what do you recommendation? Please, Dr. Inigo, maybe.
Okay. The threads in young people have to be thicker and stronger because laxity is easy to move. But when there is laxity and muscle, and you have to push and pull the platysma, the threads have to be stronger. So I don't think that there is a reason why to use thinner or slimmer threads in young people. I always use the same thickness. I don't know what Dr. Lan's opinion is.
It all depends on skin. We had to do the assessment, the thickness of the skin, laxity of the skin, male or female. All this is actually indicated. We need to go through in detail only to decide. But basically, the thin skin, we try to avoid the thicker threads. We use a smaller thread. For those thick skin, obese, we use a thicker thread. That is my practice.
Okay, thank you. Yeah, I hope this answers your question, Dr. Maria. Yeah, another question. This one is from Dr. Julia. What if the dimpling comes at the middle of the neck? What method do we use to release the dimpling? Maybe, yeah, Dr. Lan already mentioned about this. Maybe Dr. Inigo will add something about dimpling. So,
Okay. I don't use any method to release the dimpling. I also only release the dimpling of the exit point, but not of the entry point. Okay, so I never use any method for that. The only times I've used methods to release the thread or to remove it is in the face, because the face is very visible. But here in Europe, people can use scarves or things on top of the neck to cover that, especially at this time of the year when we have so much snow here in Madrid.
Okay.
I think,
That is,
uh,
because in Indonesia, Dr. Lan, maybe you want to say something?
Yeah.
Okay, please.
Here to release the dimplings, first of course I still use a basic, we are say preventive always better than treatment, so try to avoid the dimpling. So before you pull out the needle, make sure everything is in the smooth area, there's no creating any dimpling when you move around the needle. This is the first point. Second point, once you pull out the needle, then you have the dimpling, what you need to do. So use back the same cannula, the blunt cannula. Actually, it really works. So you can do it in two ways. Use the same blunt cannula, go back to the entry point, go direct, slowly direct to the dimpling area at the middle part, then start to do some force dissection. Because it's a blunt cannula, actually it can release the dimpling to some certain degree. This is a tips I think we are quite useful.
Okay. Thank you very much. Okay. I think it's we've got no other questions from the participants. Okay, we have got lots of discussion. This is very interesting. We have talked about how to do neck rejuvenation using thread. Before we close this session for Dr. Lan, could you please give some take-home message, and then Dr. Inigo also give some take-home message for all the participants. Please to Dr. Lan.
Take-home message, I would say, know your product, know the anatomy. We must have the knowledge to practice. The more you practice, the more perfect you are. That is a point I think that people need to know. So always update yourself, and then go for any anatomy dissection courses to know all the important structure, know what you are doing. Don't become the follower only. But of course, you need to know the theory behind for each of the mechanism action of each of the threads, and then what you are pulling, what you are doing, and then which is the vector and the point you need to lift. So that all the method we do, all the things we do must have a strong backup theory behind why you do so. So I think the knowledge-wise is very important. Know your product well, and especially the anatomy.
Okay, thank you very much to Dr. Lan. And then now for Dr. Inigo Felipe, please give some take-home message.
Okay, this is my message. Sometimes we are offered fantastic technology at very high prices that promise miraculous results. And my experience has been very difficult in that way, because I've been working with many devices that supposedly could induce this lifting effect, and I have seen nothing. And I'm very happy to have discovered the pyramid threads and the ultrasound technology, because they really changed my practice in terms of the neck. Today's the day that I don't do any surgery for the neck, because with just some threads, I can obtain better results. So please be very critical. Don't believe everything you listen and everything you're told, because sometimes the reality and the truth is hidden behind.
Thank you. Okay, what a great presentation and a great take-home message. Thank you once again for Dr. Lan and Dr. Inigo Felipe for an amazing presentation, discussion, and sharing your experience for all of us, the participants in virtual Iswam. Hope both of you always success and always in a good health. Stay safe, stay healthy. Dr. Lan, Dr. Inigo Felipe, and next time if pandemic ends, please come again to Indonesia, and we will have another ISWA maybe after pandemic and in Indonesia.
Because
Okay,
I
thank you.
already passed
Okay.
coronavirus. I cannot transmit it anymore. I'm immune, right? And it was not all that bad. I mean, just a couple of days of cold and that was all. So I'm free. I can travel now.
Okay, stay safe, Dr. Lan, Dr. Inigo. Thank you. Thank you once again. To all participants, so this is the end of session 16 and hope you follow the next session on the 23rd of January of Virtual Iswam 2021. So all of you stay healthy, stay safe. See you in the next Virtual Iswam. Bye-bye, everybody. Hello, good afternoon, good evening, everybody.